The Definition of Nursing, Virginia Henderson, by Zoe Saunier. Virginia Henderson, 1897 through 1996. Virginia Henderson is often referred to as the Florence Nightingale of the 21st century. Originally born in Kansas City, Missouri on November 30th, 1897, Henderson soon moved to Virginia where she was raised and spent her childhood. Henderson was educated at her grandfather's community boys' school, but she did not earn a traditional high school diploma. This delayed her entry to nursing school. Eventually, she enlisted in the Army School of Nursing, graduating in 1921. In 1932, she received her Bachelor's of Science in Nursing from Teachers College, Columbia University. She received her Master's in 1934 from Teachers College, Columbia University. Virginia Henderson's heart for teaching was evident. In 1923, she started teaching nursing at the Norfolk Protestant Hospital in Virginia. After earning her master's at Columbia, she then joined the faculty in 1934. In 1953, she received a position at Yale University as a research associate. Henderson revised the widely held and adopted Textbook of the Principles and Practice of Nursing by Bertha Harmer in 1939. She was then funded to direct the Nursing Studies Index Project, 1859 through 1971. In 1979, the Connecticut Nurses Association established the Virginia Henderson Award for her renowned works. Henderson's goal was to focus on answering what is nursing as a profession, during a time where it was often questioned. Henderson's definition of nursing was the unique function of the nurses to assist the individual, sick or well, in the performance of those activities contributing to health or its recovery, that he would perform unaided if he had the necessary strength, will, or knowledge, and to do this in such a way as to help him gain independence as rapidly as possible. Henderson identified 14 basic needs for patient care. Overall, Henderson emphasized and encouraged the need to promote health. Her view of nursing was described as that as a substitute for the patient, a helper to the patient, or a partner with the patient. Her theory had 4 major components: individual, environment, health, and nursing. She believed that a nurse's duty was to aid patients in all 14 of these components. Because the components range from physical, psychological, emotional, sociological, spiritual, or developmental, it emphasizes the need of a holistic view of nursing encouraged by Henderson. She also emphasized the importance of increasing the patient's independence so that progress after hospitalization would not be delayed. Her 14 components include breathing normally, eating and drinking adequately, eliminating body waste, move and maintain desirable postures, sleep and rest, select suitable clothes, maintain body temperature, keep the body clean and well groomed, avoid danger in the environment, communicate with others in expressing emotions, worship according to one's faith, work in such a way there is a sense of accomplishment, play or participate in various forms of recreation, and learn, discover, or satisfy the curiosity that leads to normal development and health. How is the theory beneficial? I believe her theory is beneficial for the fact that it covers a wide range of components that can be interrelated. It is not limited to just one specific instance. It is easy to understand and simple, also easily generalized, applicable to all ages, cultures, environments, etc. It guides the nurse onto how to treat and care for their patient and promotes a necessity for good health. Its limitations are Henderson's theory covers many sociological, physiological, and psychological aspects but does not touch on love and belongingness. Connection among the 14 components are unclear, the nurse's role in the dying process is not explained well, and it focuses on mental independence but does not touch on scenarios of those with mental disability. Henderson's theory and concepts are fundamental to how a nurse practices. It shows us how to understand and attend to the basic needs of the patient. Being able to know what the patient needs helps better equip a nurse for how to perform her duties in relation to a patient. Henderson's values are still taught and are widely held in healthcare to this day. I like how Henderson states that there are several influencing factors that go into a patient's care. From environmental, physiological, psychological, and social factors, they all need to be looked at as a whole when treating the patient. This will benefit me when I approach my own nursing practice one day to see the patient as a complex, intricate, emotional being. I agree with how Anderson describes nursing as a devoted and serving career. She encourages that the patient is first always, and that a nurse's main goal should be to get them back to good health. This will stick with me in my future career to always center the care around the patient.